Hi guys, it's Emma. I'm a registered nurse working here at Colorado Beauty RN in the weight loss program. I thought I'd hop on here today and talk a little bit about our semaglutide medication that we offer and its health benefits and maybe some other new things that you didn't know about it. So we wanted to let you guys know that semaglutide has been around for over 20 years. It was predominantly used for diabetic patients, and then as we all know, in the last several years, it's become more widely used for weight loss and metabolic health. What is semaglutide though? Like, what does it do in our body? So it is a GLP-1 receptor agonist. And what that is it mimics a hormone in our body that helps us to regulate our blood sugar and our appetite and our metabolism. It slows our digestion down. It keeps us fuller for longer. And it helps to reduce those food cravings and overeating that can potentially happen. It can help with appetite control. It helps to connect that brain-gut connection. And so our gut will tell our brain sooner and quicker, hey, I'm full, I've had enough, let's stop. So it's sort of in a way built-in portion control, we like to say. It also decreases the food chatter, we say, just, you're thinking about food and what you're going to eat next. It really just clears that all out of your mind. It helps with insulin support, and it helps our pancreas to only secrete insulin when we need it, which in turn helps to lower our blood sugar spikes, which are so pesky when they spike up and then crash and we feel all tired. It takes all that away from us. Some of the metabolic changes and long-term benefits that we see from semaglutide: it can help with steady, sustainable weight loss. It helps us to reduce our caloric intake without extreme dieting. It helps to improve our insulin sensitivity. It lowers our risk for diabetes and other metabolic syndromes. It helps to reduce our overall systemic inflammation, which helps to prevent chronic diseases linked to inflammation. Many of our clients will come in saying, they just feel overall puffy and their joints hurt, they're not sleeping well. And once they get on the semaglutide, they feel like they can move better, they're sleeping better because their joints don't hurt, and just that overall systemic inflammation is gone and improved for them. It helps to regulate our fat storage and energy balance, which helps to support a healthier metabolism over time. Other cardiovascular and anti-inflammatory benefits. So recent research has showed that semaglutide can reduce your risk of heart attacks and strokes, even in non-diabetic patients. It's also been shown to lower blood pressure and cholesterol. Here at Colorado Beauty RN, we have a handful of clients who have come in with elevated blood pressure, even on blood pressure medication. They have elevated A1Cs within the risky zone there, and elevated labs that just aren't looking good. And after being on the semaglutide for several months, they're able to get off their blood pressure medication. Their A1C is no longer in that risky zone. And so the semaglutide has added benefits from taking people out of those risky zones or those pre-diabetic zones into a healthier state to live. Long-term safety of this drug: there's been many clinical trials to confirm there's significant cardiovascular benefits with a low risk or serious side effects from this medication. Something interesting also about semaglutide is it has been shown to help with perimenopausal and menopausal women, of which we see many here at Colorado Beauty RN. Your body, and you're hitting that later stage in your life and your body's going through lots of changes, and it can be a really difficult time, and the semaglutide has been shown to help make those changes more manageable. How does it do this? It helps to support your hormone balance and keep them more steady to counteract those metabolic shifts that can lead to weight gain and insulin resistance during menopause. It helps to reduce our visceral fat. Our visceral fat is a fat that we tend to carry in our midsection here, all around our major organs, which that really can tend to pack on during menopause and perimenopause. So the semaglutide can help target that. It also helps to improve bone and muscle health. Studies suggest that it may help preserve muscle mass while promoting fat loss, which is a key concern for menopausal women. You want to be sure that you hold on to your muscle mass to keep your bones as strong as you can. There's also added protection for heart health. Since menopausal women are at higher risk for heart disease, semaglutide's heart protection has benefits that are especially valuable for women during that time of their life. There are many other added benefits to semaglutide that we're just finding out about. Research has suggested there's a possible neuroprotective effect when it comes to Alzheimer's disease, and helping and preventing that in patients. It's also been shown to help patients with addiction issues to reduce cravings and compulsive behaviors. Clients who have polycystic ovarian syndrome, it can help them to regulate their hormone and support their weight management. Also, we've seen patients with fatty liver disease. It helps to reduce the liver fat and inflammation that can come along with that. Other things to consider about semaglutide, it has had extensive research support and is a long-term safe drug and effective. It has minimal serious side effects. Most people experience mild side effects like nausea, but usually the nausea subsides within the first month or two. It's not a quick fix though. It's a long-term tool that we can add to our toolbox. In addition, with healthy lifestyle habits, good diet choices, we put the healthy diet, good lifestyle, active, resistance training, and the semaglutide together. Those three are really the key components to, making this weight loss, healthy lifestyle journey a success. So, in summary, we at Colorado Beauty RN are passionate about our semaglutide patients and walking them through this journey. We see you every month in person. You primarily will be seeing me, which is nice. We establish a relationship. I get to know you. We check in. We talk about any weird side effects or concerns you might have, and we titrate the dosage specifically to you and what you need, not just what, one catch-all dose for everyone. If you have any questions or concerns, I encourage you to make an appointment, an initial consultation with me where I can answer them and we can chat more about your specific questions or concerns. That initial consultation is free. There's no charge until you decide to join our program. And we'd love to see you down here. So take care, guys.